Well, we started back in 2004, and the idea was 2005, practically speaking. The idea was that we will spend the first 5 years establishing ourselves in the market as healthcare providers and be the best in provision of tertiary care. And then the second 5 years were to establish ourselves in training. So we focused on training both of healthcare providers at all levels, physicians, nurses, technologists, and so on, as well as health administration and health economics. And then the last 5 years, which start 2015, will be focusing on research. We have already established an executive level administration of research, a research center, and it is working on both basic science as well as clinical science research. And we're doing great on that line. It will take time for KFMC to start publishing major research. We have a lot of research being published every year, but it's all on the clinical side. It's going to take a lot of efforts to start building on the basic science side. So we're there on healthcare education, healthcare training. We have a number of programs. We actually have a training programs in every specialty under the sun, on medicine, in a lot of specialties, in nursing and in technologies. In addition to this, we have master programs with joint venture with international universities. Examples of that are masters in health administration, masters in quality, healthcare quality, masters in research, masters in health education. And we offer these to King Fahad Medical City students or Medical City employees on a blended learning module, where they do their lectures and classes after hours, and they do it on video conferencing and they do their most of their modules at KFMC. They end up doing their capstones or their projects at work within their work fields, and that has paid off dividends. We've done that. We've been doing that since 2006. A lot of the graduates of the Masters in Health Administration are leaders not only at KFMC but also in other healthcare organizations in Saudi Arabia.